Hello everyone, Dr. Hassaan Tohid here once again live, and I am here with a very important session, a very interesting session. And let me share this with all of you and all of the students who want to enroll, who want to join this session. I'm about to just send you the link, and everyone who is watching, please do subscribe to this channel and comment below that you have subscribed, and I'll get back to you. So we are all set, and let me share the link with you all. Okay, so I'm all set. Okay, so guys, we are going to talk about how IMGs can improve their CV. This is a very important topic, and I want everyone to take notes, everyone to be proactive, take notes, ask questions, because this is going to be an amazing session. So don't miss this opportunity of learning. And because we are going to talk about a very inspirational session today, I am telling you that you guys can make a huge difference, and all of you can match all the IMGs who are interested in applying for residency. I'm telling you, you all can match. So let's talk about this. Are you guys here? I'm waiting for all of you, and I will begin. I can see that people wanted to come, and I can see you guys are joining. So that's wonderful, because this is a live session, and you can leave questions as well. And I am right now live, and I'll answer your questions and concerns. And today's topic is what you can do for your CV to match, how you can make it interesting, how you can be more competitive, how you can increase the number of interview calls. Okay, so that's important. That's very, very important. So just keep your notes ready, a pen, piece of paper, everything ready, and we are going to talk about something really interesting. Okay, so anyone has any question before we begin? Any question before we begin? I think nobody has any questions, so that's wonderful. So we are going to talk about how you can improve your CV. That's the main deal, right? Everyone says that, how can I improve my CV? What can I do? What should I do? What should I not do? And this is a challenge for everyone, right? So how do you do it? This is exactly what we will talk about. You have how many days left? How many days left in residency application? 5 months and 7 days. 5 months and one more week. So you will be applying for residency match, or if you're applying for UK foundation or training program in the UK, or you're applying for Canadian residency, the rules are the same. The rules are the same. Wherever you go, the rules will remain the same of how you can improve your CV. So the first thing first we will talk about today is, hi, hygienist, how are you? And Mona, how are you? Hope you guys are all set and doing well, and you are all set to conquer the residency and conquer, the challenge and be successful. Okay, so we are here now. I think everyone is here, and let's begin. Hi, Rowan, how are you? So all the new admissions who have enrolled into the Be a Published Author program, your classes will begin this weekend. So are you all set? Hopefully you all are set. Okay. Hi, thank you guys. Thanks a lot. So guys, first of all, the main thing, I have my notes with me as well. I created these notes for you guys so that you don't miss anything, and you get so much of value today that you really enjoy the process. And another thing is, guys, another thing that's very important, that I specifically did brainstorming for hours to make sure that I don't miss anything that is valuable. And if I still miss something, I'll cover it next time. But this is going to be a very comprehensive session, and I'll not take much of time. I'll be short. I don't want to take it more than an hour. I don't want you guys to get tired. But today I'll fill you with motivation, fill you with inspiration, fill you with energy, so that you achieve your goal. So let's talk about this. The first thing first, when you graduate, you become a doctor. Your CV is totally blank. You just are a foreign doctor. Your CV is blank. If you get a job, if you apply for a job, you will get an entry-level job. Nobody cares about your recent graduation. So remember this, simply graduating as a doctor, not doing anything, does not mean anything. Now you say, what are you talking about? I'm telling you the truth, because you haven't become that valuable. Now, let me give you an example. This is a very good example, a very important example. This pen, how much do you think this pen will cost in the market? Any guesses, any idea? How much this pen will cost in the market? Any guesses? You guys can type and let me know. How much will this cost in the market? Will this be $100? Will this be $500? Will this be $10? Will it be $3? Will it be $5? Yeah, of course, maximum it could be like $3 or $5, but actually it was 50 cents. I got a dollar packet with 2 pens like these in $1. So this is a 50-cent pen. Now, the point is, this is a 50-cent pen. Can I sell this pen in the market of $50? Will people buy it? This is a challenge. Can people buy this of $50? How can we sell it for $50? And this is a very big example. This is related to you, your future, your career, your life. So this is a very important topic. You've got to focus here. This is a 50-cent pen. Can I sell it for $50? Yes, if I do nice packing, or if I make some designs on it, I can sell it for $50. But can I sell it for $100? Absolutely. No, if I just advertise it and advertise it well and I sell it, it's scamming. It's fraud. Can I increase the value? Absolutely. Absolutely. If you market it well and you sell a 50-cent pen in $50, you have cheated. You have defrauded people. This is wrong. This is fraud and scamming. I'm talking about real price. 50 cents. Can I sell it for $50? Can I make it $50 value? Yes. As Ramisha typed, if Obama uses it to sign. Yes, now I can market it. It's not now 50 cents. It can actually be sold of $500 because an ex-president of the US has signed, has just touched it. The value has gone up. I make more designs on it and I make it prettier. I do some colors, some paintings, some microscopic paintings, or some kind of beautiful design that is only seen when you uh, change the position. The value goes up and up. Can I sell it at $1,000? Absolutely. Now, let me give you an example. If I dip it in gold plating and I take it out, if I dip it in gold plating and take it out, can I now sell it at $1,000? Now it has gold plating on it. Absolutely. If I now insert diamond on it, now can I sell it of more than $1,000? Absolutely. If I add two diamonds on it, can I sell it of $2,000? Now the same pen, can I sell it of $1,000, $10,000? Absolutely. If I keep adding diamonds, the value will go up. More demand and the value will go up and people will say, wow. And is there a limit? Is there a limit of the value? Is there a limit of how much value I can take up? If I keep adding more and more and more and more and more diamonds, can I sell it at $100,000? Yes. Can I sell it at $1 million one day? Yes. If I keep filling it with diamonds, if I keep filling it with diamonds, I can sell it at $1 million, $2 million. If I keep adding, and this pen will become thick and thick and thick and thick. It will probably be this thick, and it now has diamonds and diamonds and diamonds, and it can be sold of 2 million, 3 million, 4 million. There is no limit. More gold plating, more diamonds, more gold plating, more diamonds, no limit. It's no more a pen, it's something unique. It's a unique pen. So much of diamonds, you can still write with it, but it's a unique pen. Such a thick pen, such a pretty pen, or maybe ugly pen, but it's valuable. With so many diamonds, it will probably look ugly, but the value will still go up. The same thing happens with everything in this world. The same thing happens with us human beings. When you graduated as a simple doctor, you were like this pen. No added value, nothing. If you apply to any residency programs, people will not care about it because there are hundreds of people like this. Simple graduates, hundreds and thousands of people like this. 40,000 IMGs applied for residency. 40,000 people applied for residency this year. $40,000 is a huge number. Everyone is like this. When you take USMLEs, you're ECFMG certified. Now you have a gold plating. Now everyone is equal to $1,000, but not more than that. Now, how do you add more diamonds? And there is no limit of diamonds. Remember now, this is a phenomenon I'm telling you. Life-changing phenomena. I want all of you to keep it for the rest of your life and keep applying it every day and every week, every month. Everything you add on your CV is a diamond. Everything that you can add on your CV is a diamond. And is there any limit on how many diamonds you can put on your CV? No. There is absolutely no limit how many things you can add on your CV. And the whole competition is the person with the best CV, with more things on the CV, will match. Now, first of all, at least you will get interviews, plenty of interviews at great programs, wonderful programs. So it's all about how many things you have on your CV. Now, the question is, if you know this, why can't you do it? Why can't you add things on your CV? Why are you wasting time? Why are you watching TV? Why are you watching sports? Why are you watching movies? Why are you wasting time when you know that you have only 5 months and you have so many things to add on your CV? Now you can only add limited stuff on your CV because you have limited time. You have 5 months. How much you can add? Now, if your target for residency match is next year, then you have plenty of time to add way more things, and when you apply, you will become a giant. You should become that kind of giant. Your CV should have these many things that when the residency directors look at this, say, wow, look at his CV. He has so many things on his CV. He has done so much. He has done so many things. He has so many accomplishments. He has probably achieved more than I have. Can you do that? Absolutely. Many people ask me how I achieved so much. Guys, I used to look at the CVs of professors. CVs of professors, program directors. When I started my career, I used to look at their CVs. They are available on their profiles on different websites. Their CVs are available. I used to look at their CVs and I used to see, wow, 40 page, 50 page, 120 page CV. Because CV can be big. Resume is short, but CV can be big. So I used to see the CV and I used to see, wow. So what else people add on their CVs? Okay, this can be done. Oh, this can be done. Oh, this can be added. Oh, this can be added. Oh, that can be added. Okay. So this everything is a diamond. Some diamonds are small, some diamonds are bigger. Some things you add on your CV are equal to 10 diamonds. Yes. Some things you add on your CV are equal to 20 diamonds. Some things you add on your CV are equal to 1 diamonds. So consider your CV as a thing where you have to add your diamonds. And not only just CV, every diamond should be added on your personality, because anything you do increases your knowledge, your experience, your skill, updates your skills, upgrade your skills, and it upgrades your skills, upgrades your knowledge, and it makes a different person out of you. You become something different. And it is pretty evident from your personality. It is pretty evident from your personality. So you got to understand this. It is pretty evident from your personality. Because every course you take, everything you add on your CV increases your confidence level, your personality changes, it is visible in your personality. If you add just things on your CV without actually achieving it, like let's say you are getting fake certificates or just adding certificates, buying certificates from some unethical means, you have not added diamonds on your CV. Because they see your CV, they see diamonds, they bring you for interview, they want to see if these diamonds are real or not. That's all. Some people, they keep adding their names in publications, their friends' publications, their fellow classmates' publications, without working hard, and they think residency directors are fool. They're not fool. Residency directors are not fool. They are smarter than you. That's why they're there. You cannot fool them by adding your name in publications because of your friends, your colleagues, and not working hard on it. That's why they call you for interview. When they see your CV is descriptive, and on resume you just take something extra off, and you don't give the explanation of everything you have done. You don't provide the explanation. Sometimes you become that kind of valuable person, you have achieved this much, that your resume, even your resume, cannot be squeezed to less than 4 pages. Even if you use small fonts, you can still not reduce it to less than 4 pages. Think of that goal. Think of that aspect. Some people have only these much of achievements that their whole CV is not more than 2 pages. It's curriculum vitae. The CV stands for curriculum vitae or curriculum vitae, some people call it, but curriculum vitae is mostly the terminology that is used. CV stands for curriculum vitae. And in curriculum vitae, you have everything mentioned that you have done so far, all the diamonds you add, and that's your marketing tool, that's your advertisement. Now they will call you for interview to see if these diamonds are real or these diamonds are fake. That's all. Consider your interview as a test if the diamonds are real or the diamonds are fake, because your personality will show them. Your confidence, the way of talking, the way of communication, your energy level will tell them if it is real or fake. When somebody sees my CV, when somebody sees my CV, now they have seen a lot of diamonds, right? They talk to me, they want to see if these diamonds are real. And when they talk to me, they go back impressed because I have earned everything on my CV. I did not get any free lunch on my CV. I worked hard. I spent hours, sweat and blood, literally sweat and blood. That's why when somebody talks with me, they see the energy, they see the personality, they see the confidence. Where is this confidence coming from? This confidence is coming from because the diamonds were real. Because the diamonds were not only actually on the paper, the diamonds were here inside this personality, inside this brain, inside this soul, inside this spirit. I absorbed the knowledge and it made a different person out of me. That's why I can communicate like this. That's why I talk like this. So the diamonds will be visible in your personality. That's what they want to see, if these diamonds are legit. Now let's talk about this. So decide you will have more diamonds on your CV, because there is no limit of how much you can grow. And remember, but you have limited time before the math season. So what else you can add? First of all, I want all of you to decide. And second thing I want all of you to do is focus, focus, focus. That means no other thought should come to your mind besides adding things on your CV, adding things on yourself, adding things on yourself, adding things on yourself. Don't misconstrue this word. Don't confuse this word of just adding things on CV. I know somebody who used to get free lunches, adding his name as second last third author, third last author in papers every time. Because of contacts, he was just adding his name without doing anything. The person is a clod. The person is a person with no personality. When you talk with him, you will find out, oh, his CV has a lot of diamonds, but look at him when we talk to him. There's no energy. You can tell this person hasn't worked hard. This person has no diamonds in real life. It's just on paper. So remember, you add diamonds on your CV and yourself. That means whatever you add, you absorb it. When you write a paper, you absorb that knowledge. When you add anything on your CV, you absorb that knowledge. And we'll talk about this. What can you add? Number one, clinical experience. US clinical experience. Now let me give you an example. Can people get US clinical experience without doing anything? Yes. Unfortunately, there are liars, fraud people, bad people, and good people too. The world is a mix of good and bad people. So there are people, there are IMGs who will probably be adding US clinical experience on their CV without going to a hospital, just because of contacts, friends, just because they knew somebody, just because they knew somebody from their country who was in charge out there at that hospital, and they got a letter of recommendation that actually was a lie. So he got a diamond on his CV. But now the question is it a real diamond? Somebody who falsely wrote US clinical experience just because of contacts while he did not go to the rotations. He has a diamond on his CV. The question is, I'm asking you all, is it a real diamond? Common sense. Please type. Type and tell me, please, is it a real diamond? I'm looking for a yes or a no. Very good. Exactly. This is a fake diamond. Now, do you think residency directors, when they see the CV, of course, now they are impressed. Now they want to see if this diamond is real. They call this person for interview. Now, will they catch it or not? Absolutely. They are. I told you, remember this. Residency directors are not fool. They are on that position because they had diamonds on their personalities. Nobody can fool them. They have achieved that status of being the residency director by by working hard every day and with the real sweat and blood. They have achieved that position. So they know what a real diamond is. They themselves have diamonds all over their body, their personality. That's why they're residency directors. Now, a diamond, a person full of diamonds, is calling you for interview to see if you are really a diamond. How much time will it take to understand if he's talking to a real diamond? 2 minutes. 2 minutes. Your body language. If you haven't achieved things, you have added fake things on your CV, you will be fearful. The radiation that will come out from your mouth and your eyes will tell them, oh, he has so much of clinical experience on his CV, but look at his confidence level. Look at the way he sits. Something fishy. We don't want to call him for residency. We don't want to rank him. That's why adding the biggest blunder you can do on your CV is by lying or getting anything fake where you actually did not work hard. Without earning, you added something on your CV. Don't ever do that. You will be caught. You will never ever be able to succeed in your life. Will destroy your life. You know why? Another thing, some residency directors can do this. Like they see you, they interview you, and they say, "Wow, fake diamonds." Okay, fake diamonds. They say, "Dr. Jackson would like to interview you," and they say, "Dr. Jackson, talk to this guy." And now Dr. Jackson also knows that, oh, Dr. Marshall is smiling. That means he has caught a fake diamond. Let me talk to him. Hmm. Now, chief resident also talked to you. Chief resident can be fooled. Okay, he's new, so he can be fooled if he's interviewing. But anyways, everyone interviews you, and everyone unanimously agrees that this was a fake diamond because they will ask you some clinical questions to see how much did you learn during that rotation. You talk to hundreds of people every day. They interview hundreds of candidates for few positions every year. They can also detect lies. Forget about catching diamonds. They can detect lies right away. So now what they will do, they will also probably discuss that to their friends on phone or in some meetings. They will say, oh, there was a guy, his name was this. Be careful. If you call him for interview, be careful. People remember these kind of people. And these kind of news, they circulate. They circulate. And it is all happening behind your back. You don't know it is happening. So try to understand. Be 100% honest. Be 100% ethical. And every diamond you add on your CV should be earned diamond. That means when you go to a clinical place to get some rotation, learn every day. Take notes in the rotation. Learn, and be deserving and get the letter. Remember the formula. Life does not give you what you want. Write it down. Somebody said that. It's a very famous line. I don't know who said that, but this is a very famous line and one of my favorites. Life does not give you what you want. Life gives you what you deserve. So be deserving. Learn from your rotations. Learn. Learn from your research experience. Learn. They may ask you how systematic review is written. If you don't have the steps on your fingertips, they will catch you. Are you a real diamond or not? So remember the steps, whether traditional review, systematic review, should have on your fingertips. They say, oh, you wrote a systematic review. Wow, you as a first author wrote a systematic review. Unbelievable. Even I don't have a systematic review as first author. Now, let's say the director is telling you this. How did you do that? Can you please tell me? You say, yes, sir. There are 3 phases. Phase 1, phase 2, phase 3. In phase 1, you decide your topic. You decide your research question. You decide your PICO question. And you say, okay, very good. Fingertips. How did you do mesh strategy? Tell me about your mesh search strategy. So yes, mesh search strategy. So you just divide your research question into the concepts. I divided my research question into 4 concepts. Concept 1, concept 2, concept 3. Then I searched the mesh strategy. I went to the advanced. Okay. He's a real diamond. Look at the confidence. Look at the body language. Now you understand the point? The difference between the real diamond and the fake diamond? Real diamond is hard, cannot be broken. This is the property of diamond. You cannot break it. Fake diamond, you pressure it, breaks. So they will try to pressurize you in the interview to see if you are a real diamond. If you're a real diamond, pressure does not break you. Guys, I'm giving you $1 billion information. This is going to change your life. Remember today's lesson for the rest of your life. I wish I learned this when I was young. Somebody taught me when I was a kid. I wish that if I were to go back in time, I would pray that I knew this when I was a 10-year-old. I would have a whole different life today. But no regrets. You learn with experience. And nature gives you the message when nature sees that now you are ready. You are getting this message. All of you who are listening today, you are listening to this message because nature wants you to listen to this message now. Now you are ready to become a diamond, a bigger diamond who adds more diamonds. Okay, so now US clinical experience. What kind of experience will have more value on your CV? Of course, if you did electives when you were a student. Externships versus observership. So there are 3 kinds, right? Everyone knows? No. I'll say there are 4 types. So write it down. Electives, that is done when you are a student. If you are a graduate, this is out of question. Elective opportunity is gone. Second opportunity is externship. Difficult to get, but it is possible. Do you get hands-on experience? Yes. In rotations, in electives and in externships, you can get hands-on experience. So externships are difficult to get, but you can still get it. There's so many places who provide that. Formula is the same. If you watched my video on how to find research jobs, formula is the same to get any position. You watch that and you will understand. And I'll do another session one day on clinical experience too. Now the third one is observership. It's a lower kind of experience, but is it a diamond? Yes, of course, 1 diamond. Externship will be 3 diamonds, I would say. Electives and internship will be 3 diamonds. But observership is 1 diamond. But now observership is, if let's say is 1 month, 1 diamond, but if observership is 6 months, 2 diamonds. Externship 6 months, 6 diamonds. Externship 10 months, 10 diamonds. Externship 1 year, 12 diamonds. Give them a rating with diamonds, just for your understanding and your goal setting. I'm giving you this phenomena. Give 1 month of rotation 1 diamond. If it's externship. Half observership. Let's say give half. So let's say if you did 1 year of observership, okay, it's fine. Consider 5 or 6 diamonds. But of course, externship has 12 diamonds. Does it make sense now? This is very clear. Now, but this has to be the real 12 months. A person who does 12 months of externship, do you think he's a joke? Do you think residency directors will be fooled if you get a fake letter? They will catch it right away. They see, wow, what a person. 12 diamonds just by a US clinical experience of externship, hands-on. Call him for interview. Let's see if he's real. And you go there. The moment you sit, they know he's real. And if they still cannot detect by looking at you for a few seconds, they will see it in next couple of minutes. They will ask you some clinical questions. They will ask you some hospital-related questions, some healthcare-related questions that everyone must know when they have been with a hospital for 12 months. And funny thing is, let me tell you one thing. You mentioned, let's say, I have clinical experience 6 months at this, hands-on at this hospital. And you go to the residency director and he says, okay, he's real. Let's find out. Hi, how are you, John? Oh, very good. We saw you have 6 months of experience in this community hospital XYZ in Alabama and here in XYZ. Oh, yes, sir, I had this experience. And inside, deep down inside, you know that the person in charge was your dad's friend and he has just given you the letter. Now he says, who was your supervisor? You say, you tell the name. Okay. Do you remember the names of other doctors out there? All residency directors are friends with each other, guys. With the program directors, with different hospitals, they're friends. So they want to see if you remember the names. They'll say, okay, what about Dr. Wilson? You say, oh, Dr. Wilson is really good. And now the residency director knows there is no Dr. Wilson in that hospital. And he's enjoying, he's playing with you. Do you understand how easy it is to detect a real diamond? So don't ever lie on your CV. Varnisha has a question, does it make a difference where, in terms of where you do rotations? Absolutely. Number of diamonds will be different. If you do externship at Harvard University Hospital, Mass General, or UCSF, instead of 12 diamonds, you can say 15 diamonds. Look at the name Harvard on your CV for the rest of your life. It's a huge diamond itself. Versus a community hospital that nobody remembers the name, nobody knows. Versus a private clinic, lesser number of diamonds. If it's a private clinic, 6 months, I would say 1 diamond. If it's a community hospital, 6 months, okay, 3 diamonds. If it's a university program, 6 months, hands-on, 6 diamonds. So use common sense and give yourself points in terms of diamonds, how many diamonds you have on your CV. Does it make sense? Does it answer your question? So choose the rotation smartly. Now, if you cannot find anything, then whatever you get is fine. Go add some diamond rather than sitting idle until you find a better opportunity. Get to the private clinic, even the private clinic, until you find the residency program rotation or a big university program. University of California, Davis, UCSF, UCLA, Duke University, Mayo Clinic, Harvard University, UIC, UT, UT Austin, UT Houston, giant universities. They will make a huge difference, of course. The name sells. Remember, you are there to sell. So the name will make a huge role, play a huge role. Can we fill our gaps by extending our clinical experience? I would say tricky question. Depends on the residency director, how they see it. But why would you do that? The year of graduation is a cutoff for many residency programs. Okay, so now what else besides observership? Fourth one, telerotations. Telerotations nowadays, post-COVID, there are so many opportunities for telerotation. They will be counted as observership, but they are rotations. Instead of sitting idle, not doing anything at home, go and get telerotations. Telerotations, they play a huge role. What else? What else can we do? Is there a fifth way of clinical experience? Yes, volunteer. Volunteer, guys. Private hospitals don't usually allow volunteership, but public universities and non-profit public universities, public hospitals, non-profit hospitals, non-profit organizations, rehab centers, they will allow volunteership. So yes, if you don't find anything, go and be a volunteer at a hospital. Will it be lesser diamonds? Of course, but will it be worth it? Absolutely, rather than no diamonds. If you spend any single day without doing anything for these 5 months, you have messed up. Don't lose a single day. You should be enrolled into you are already enrolled in research program, but can you, our program, and that's wonderful. You will have something to show, huge thing to show on CV. And we'll talk about the diamonds of publication, how important they are. We'll talk about that. But is it possible to add more diamonds at the same time? Yes. Why can't you do telerotations? And why can't you do just telerotations plus real rotation nearby in a private clinic? If you're done with USMLEs, you are all free. Spend few hours writing your paper and then do your rotation, telerotation 2 days a week, and the remaining days a week you go physically to a private clinic, because you know everything is a diamond. And every day when you go there, you are absorbing something. Your personality is improving. Your personality is improving. You are understanding the language. You are talking with people. Every day you are becoming better and better. More and more diamonds are added. It is also possible that a private clinic observership, gives you 10 diamonds. Is it possible? Yes. If you acquire knowledge of culture, if you acquire language skills, if you learn to understand the American accent, because of that rotation, you learn to understand the American accent, you learn to understand the American culture, you learn to understand communication, your vocabulary increases, your communication increases, your communication improves, your language improves. You actually got 1 diamond on CV, but in real personality you have 10 diamonds. And when they will see you in the interviews, they will see that his CV has 1 diamond, but look at him. In reality, he way more. So can you be way more than what your CV shows? Absolutely. So you can be exactly what your CV shows. You can be more than what your CV shows. And this is 100% match. If they see this, that look at his CV, we were very impressed with his CV, but look at when he came and we talked to him, what a personality. He's way bigger than his CV. Or you can be this too. Never be this, that you have more things on your CV, but in reality, you are a failure. So all three possibilities. All three possibilities. Do you understand the phenomena, guys? How success works, how career works. And remember, everything you have attracted by the person you have become. Jim Rohn, he used to say this. Everything you have attracted by the person you have become. If you want to attract a good residency program, be a person of that caliber. So the residency program attracts you. And usually you attract residency program of higher nature to attract you when you are actually bigger than them. They will be more attracted to you. That means you are better than most candidates. You have more things on your CV than all other people who have applied. And everything and whatever your CV has, you are really way bigger than what you have on your CV. So what actually you are doing, you are adding more things on your CV, but you are adding more things on your personality. The way you talk matters. Nothing can replace the diamonds you bring because of your communication skills. And if you are in the US, sitting idle, not doing anything, why can't you join Toastmasters? They will help you practice talking in front of people. In interviews, you will not be scared. Why can't you join Toastmasters? 1 day a week, 1 hour, that's it. They will teach you how to communicate with people. Toastmasters. Your interview skills will be tremendously way ahead. Toastmasters is so economical. They will charge you like $100 probably for 6 months. And you will be a whole new person in 6 months. Every city has Toastmasters. Every city in every country almost has Toastmasters. Type Toastmasters meeting near me, Toastmasters meeting near me, or Toastmasters near me on Google. Type it on Google and call them, join them right away. They will teach you how to talk. You will not be under pressure during the residency interview because Toastmasters itself is giving you so many diamonds on your personality. They will improve your listening skills. They will improve your communication skills. They'll improve your body language. They train you. They train you how to talk, how to communicate. Anyone who joins Toastmasters, they become a whole new person after a few months, 2-3 months, actually 1 month. My fellow Toastmasters, we used to discuss, yes, I have joined Toastmasters and I'm not marketing them. No. Toast, Toast Masters, one word, Toastmasters. So they teach you public speaking. And when you do that, you actually prepare yourself for interviews too. You will learn to talk. Your confidence level will go up. And try to join physical meetings if they are having face-to-face meeting nowadays. Try to do that if there is any. But even if not, then online is okay. On Zoom is okay too. They will right away in the first day, they will stand you in front of, they will put you in front of a crowd. They will put you in front of all the Toastmasters in the meeting. There will be like 20, 25, maybe 30 or 40 people. They will put you in front and they'll say, okay, talk. The first day you will be scared. Second day you will be better. Third day you will be better. And after 4 or 5 months, you will be a speaker. So they are adding you, though, they can add the diamonds on your personality. So the diamonds on personality also matter. They matter more, actually, to be very honest. But can we ignore CV? No, because CV is the marketing tool. They don't have time to see you. They just want to decide whether to call you for interview by looking at your CV. So work harder on your CV and work harder on yourself. And remember, working harder on your job makes you a living, but working harder on yourself makes you a fortune. Jim Rohn used to say that working harder on yourself makes you a fortune. You have 5 months, only 5 months. What do they make you talk about at Toastmasters? They say you have 7 minutes, decide a topic. Next week, you will be speaking. Talk on any topic. You say, I am a doctor. Can I talk on heart? Absolutely. Can I talk on kidney? Absolutely. Can I talk on ENT? Yes, absolutely. Can I talk on brain diseases? Absolutely. My talks were always on neuroscience, psychology, and neuroscience. When I was at Toastmasters, I used to talk about neuroscience, brain, human brain cells, mirror neuron cells. So not only I increased my knowledge in my field, but I learned to talk and learn to communicate. You see this magic coming out of Dr. Tohid, how he speaks so well. I have worked really hard on myself, guys, every single day. That's why if somebody tries to compete with me, he cannot. Because I have gone through the process, and you will go through the same process. You just talk about, you take glomerulonephritis and you talk about glomerulonephritis. You talk about the signs and symptoms of the disease. In 7 minutes, you finish. And this will be the treatment. Thank you. Now they will tell you where you were right, where you were wrong. Okay. Now, research experience. You have research experience with CIBNP. That's wonderful. Now, if you cannot find clinical rotation, try to get research experience in the lab. Now, you will say, what kind of person he is? He himself has a research training program. IMGs enroll in his program, and he is encouraging people to join research positions in lab. Yes, guys, because I don't care about my institute. I care about you guys. I care about IMGs. I care about you. You should join any other research position you find, any other research opportunity you find. You go ahead and do that, because everything is a diamond. Every single thing is a diamond. You will have online research experience, right? But if you have live in lab experience as well, look at the combination of both. See what will you look like when you go for residency interview. Everything is a diamond. Don't underestimate anything. So I'm not that kind of person. I'll say, no, our training is best. Don't go to labs. No, go to labs. Even if you get animal experiment, animal research, in vitro research, go ahead and do that, because it will be lesser diamonds, but you will learn communication skills. You are adding diamonds on your personality. You talk to people, you communicate with people. So if you cannot find clinical experience, go and find lab experience. Be a volunteer. If you can find paid position, go ahead and do that. You can watch my video on how to find research jobs. Same phenomena will be used if you watch that video. I conducted that session 2 weeks ago, probably. How to find research jobs in the US. Same phenomena is to find a rotation, research rotation at a lab, volunteer position, 1 month, 2 month volunteer position. What you will learn? You will learn how labs work. How many instruments do labs use? What kind of computer softwares do they use? How many people are usually in the lab? What stuff is found in the lab? How many hours in the lab people usually work? It will give you that idea. Does this add any value, any diamond on your personality? Absolutely. And does it add any value and diamond on your CV? Absolutely. Anything you do will add diamonds. Some will add 1 diamond, some will add 2 diamonds, some will add 10, 20 diamonds. Like a first author publication as a systematic review, 20 diamonds. Suddenly, if you want to jump, half 20 diamonds, get your systematic review published. You want just 5 diamonds, get a case report published. 2 systematic reviews, 40 diamonds. 3 systematic reviews, 60 diamonds. 5 systematic reviews, 100 diamonds as first author. Remember this. This is very important. First author. Second, third, fourth author systematic reviews, 8, 9 points, 10 diamonds. Still very good. But the first author is a giant. Don't ignore that. And don't ever be that kind of person that who has second author, third author, fourth author, fifth author papers, but does not have a first author paper. It can go against you. Residency directors may think that you got these publications because of your friends. But if you have at least 1 paper as first author, nobody can doubt your skills, because nobody will give you first author paper for free. So they know if you have at least 1 paper as first author, they know that this person is a real diamond because he has first author as a proof. First author paper as a proof. Nobody gives first author paper free to anyone. How long does it take to write and publish a systematic review? 7 weeks. Our students have done it in 7 weeks. Our students have done it in 6 weeks. One student published a paper in 5 weeks, and one student completed her systematic review in 5 weeks. Systematic review in 5 weeks, because she was done with her exams. She had all the time at her hand. But if you have other responsibilities, 7 weeks, 8 weeks to complete the paper, and then publishing, rapid publishing process can take like 1 extra month. So a sudden jump of diamonds suddenly are added to your CV and your personality once you publish a systematic review as a first author. I mean, remember, these points are hypothetical. I'm just saying, hypothetically imagine that these points exist. There's no universal rule that a systematic review will be 20 diamonds, but I'm saying hypothetically give it a value of 20 diamonds just for your understanding, so that you can calculate and plan how many diamonds you want to add on your CV. Rapid publication process can take 1 month, yes, after your paper is completed. Okay, so now research experience can also be paid job or volunteer, observer, research observer. So whatever position you find, go get it. If you are not getting clinical rotation, you can find a research position. Meanwhile, don't sit home and not add anything on your CV as a diamond any single day. Every single day you should be planning and adding something, trying to add something on your CV. But can you add something every day? In your personality, you can. By learning even a new vocabulary word, you can add more diamonds, of course. By learning more new words, you can add more diamonds on your personality. But are these visible on your CV? No. So you got to make sure you do both. Adding more diamonds on your personality and adding more diamonds on your CV. And on your CV, you may take some time. Like if you take short courses, you can finish a course in 1 day, short course. Some courses can take like 2-3 days. Some courses can take a week. So yes, you can add diamonds. You can add like 4 to 10 diamonds every month by adding more and more certificate courses. That's why we have given you some free certificate gift courses. We usually charge for those courses, but we have given you as a gift. Why I have done it? Because I want all of you to add more and more diamonds. Consider every short course as 2 diamonds. Every short course on your CV as 2 diamonds. Complete it and learn from it. Don't just add certificate. Otherwise, it's nothing. You will be exposed, because we discussed that already. So every short course, so I have given you like how many courses? 11, 12 courses. Complete all of them, you have a bigger CV. And at the same time, where can you find more courses? Can you find more courses related to your specialty? Can you find courses on internal medicine? Absolutely. Can you find courses on psychiatry, psychology? Absolutely. Where are those courses available? Okay, write down the names. Now, again, people will say, oh, you have your courses, but you are marketing other companies. Yes, I appreciate them. I love them. But they are helping IMGs, they are helping people. And I want you guys to be benefited. Go to Udemy, 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 and type medicine. Now, let's say, can you believe I'm enrolled in Udemy courses? I love Udemy. This is Udemy. Hold on. Yeah, this is Udemy. Harvard courses will be expensive. If you can afford it, go ahead and do that. If you want cheaper courses, $9, $10 courses, Udemy. Now, I'm on Udemy, right? Now, let's go to medicine courses. I will type the word medicine in the search bar. I typed the word medicine in the search bar, right? And I clicked on it. Once I clicked on it, now see how many courses related to just medicine show up on Udemy. Udemy. Look at the list of courses related to medicine. Herbal medicine, diploma course on herbal medicine, just $15, $16, $19. Introduction to longevity medicine. Why not? You should. You should add these courses on your CV. What I'm talking about, every short course is 2 diamonds. Now, Dr. Tohid is marketing Udemy, who can be considered as my competitors. No, nobody's anybody's competitor. They are a blessing for IMGs. You should go and get these courses. They're extremely valuable and extremely economical. Medicine courses. Sound, true, present, good medicine. Look at this course, $15. Fully accredited natural medicine herbalism, if you're interested in herbal medicine. Okay. Women's medicine course on women's medicine. Can you see that? How much is it? $12. Women's hold on. This is just by using food as medicine. So many courses just for internal medicine. Yes, certificate courses, and many of them are accredited courses. You can add them on your CV. Every day you can complete each course in 1 or 2 days. So you see how many diamonds you can add on your CV. Did you ever think of that? It depends how serious you are about your life. If you're serious about your life, you'll find a way. If you are not serious about your life, you will find an excuse. And that's what you have been doing so far. Finding excuses. Take out excuses out of your life. Take absolute responsibility of your life. It doesn't matter what kind of course it is. Remember this. Certificate and a course, and you increase your knowledge. You increase your knowledge. A certificate course is a blessing that it increases diamonds on your personality and also on your CV. Like, for example, our training is also adding certificate on your CV. It is giving you, but also giving you publication, right? So and a skill itself is a new diamond. Of writing a systematic review, traditional review itself is a diamond. But the things you are learning today, for example, every new thing you are learning today is adding more diamonds on your personality, because these are the things you didn't know before. When you submit, okay, so we will discuss that. I'll have to see, you just, guys, where can these be added? According to recent era's application. And you will also give a brief highlight of these courses. you can give brief highlight of these courses on your personal statement. Our research course is a comprehensive, humongous course. So yes, you should mention that on personal statement, that you worked on a publication, you learned systematic review, and you wrote a systematic review. Doctor of Natural Medicine, another course I found very good. So that's how you do it. Okay, where can you do that? I'll send you some suggestions. I'll send you some suggestions. You know, my camera got blurry because I brought the cell phone in closer. Okay, what else you can do? Skills. What skills will help you in showing more diamonds in the interviews? Any skill. Computer typing skill. If you can learn typing, you can take a course on typing, you improve your typing, you have faster speed of writing and typing. That's what they were testing in CS, remember? Hospitals will be very happy, programs will be very happy if you say, I can type really fast. During the interview, you mentioned, I can type really fast. And you mentioned that on your CV as well. You know, your copied CV, your PDF can also work. So I think Rawan has answered the question for everyone. Add there under the education section. So I think the application is still the same. Can be a system administrator be an absolute? Everything is a diamond. Let me tell you one thing. I just took a course, neuroeconomics. It was not my specialty. I didn't like it. I just took a course, neuroeconomics. A professor contacted me and gave me a wonderful opportunity once. He said, I saw you are interested in neuroeconomics, and very few people are interested in that. And I'm an expert, internationally renowned expert on neuroeconomics. I got a great opportunity. So you never know. Maybe you took a course on something computer related. Maybe that was your passion. And now the program director is talking, and surprisingly, you don't know he loves computer programming. And he also has taken that kind of course. And those unique courses, they can talk about this. Oh, we understand your medical background. We see that. Talk about this, how you got into Python software, how you got into SPSS software. By the way, we have SPSS course. Many of our students graduated from the course. How did you get into our language? Oh, how did you learn computer Java? How did you learn Java? You say, because I'm a developer as well. Wow, I love computers. They will remember this. Oh, you remember the doctor who was a computer expert? We are ranking him. We need multi-talented people. Skills. What other skills you can add? All of these computer skills. And your systematic review writing is a skill. Data collection is a skill. You mentioned that on your CV. Skills. When you apply for any position, in the CV section, you will have the skill section. So add that in there. Two pages a resume. 2 pages a resume. CV can be longer. We are working on making your CV bigger. Remember? Try to differentiate CV from a resume. What else? Another website for courses, guys, Udacity, 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 Udemy, Udacity, and third one is Coursera. You can take courses of your specialty on these websites. Type the specialty name: neurology, neuroscience, psychology courses. Udacity, you're correct in spelling. Yes, that's correct. So you have these many places to get courses, and of course our courses, you have those too. And also, what else? Skill. What other skills? Language skills. Your home language: Arabic, Hindi, Urdu, Punjabi, Pashto, Sindhi, Chinese, Mandarin, Cantonese, Tagalog, German, French, Italian. I already mentioned that. Italian, French, Russian. Every language you have, you know, you must mention it, and you find reasons to mention that in the interview as well, on your personal statement as well, so that they remember you. You remember the doctor who knew Italian? Or you remember the doctor who could speak Greek? Or you remember the doctor who could speak Punjabi? We have a huge Punjabi population here. Everywhere, every hospital will appreciate that if you speak Punjabi. And now, which is the most powerful language besides English in this country? Anyone? I haven't mentioned that language yet. Which is the most powerful language in this country besides English? Spanish. Yo aprendí español. Sí, yo aprendí español. Yo hablo español. Muy bien. Porque yo hablo español. Porque yo aprendí español. Why did I learn Spanish? Because I knew it is equal to like 10 diamonds. It is equal to 10, probably 20 diamonds if you are really, really fluent. Spanish is a lot of diamonds on yourself. Now, if you already know Spanish, wonderful. If you don't, you have 5 months. How much Spanish can you learn? I learned basic Spanish in 40 days. Intermediate Spanish in 6 months. And since then, I'm still learning every day. What else? Spanish, right? Spanish will give you value. But if you don't have time, I understand you don't. Why don't you just purchase a book of medical Spanish and just learn to take history in Spanish? Will that add some diamonds? Absolutely, on yourself. Medical Spanish courses. I'm thinking to bring a medical Spanish course. If you guys would enjoy it, I'm thinking to bring it. Medical Spanish for doctors. Not many people will take it, but I believe it's a very powerful thing. And it will help IMGs. Okay, I'll do that. Now, next thing, history taking skills, guys, history taking skills. When you go for rotation, what are you doing out there? Why can't you just learn history taking skills? What was USMLE Step 2 CS teaching you? It was teaching you to take history. Now there is no more CS. Is OET enough? No. You gotta learn to take history. Your history taking skills. And you can proudly say to the director that I'm very good at taking history. Make sense? Clinical history taking is a skill. What else? Typing and language, Spanish, medical Spanish. You say, I can take history in Spanish. I can take history in my own language. I can take history in Spanish. And of course, I can take history in English. And I'm very good at taking history. They'll say, what a multilingual person. They don't care now. If you're fluent in Spanish, at least you know medical Spanish. That's it. You can talk to a patient. If you can know medical Spanish, you can talk to a patient. Can it impress the residency directors? Absolutely. Should you mention that on your CV? Absolutely. Is it a diamond? Absolutely. Of course, it is less diamond than somebody who is absolutely fluent, but is it still a diamond? Absolutely. And now, somebody now coming to something that is 30 to 40 diamonds. Can anyone tell me what can be 30 to 40 diamonds? 30 to 40 diamonds. Any guesses? Guys, we have like 5 minutes more. I'll finish it. But before that, I want to see if you guys can guess. Diamonds. Anyone? Anyone can tell me what can be equal to 30 to 40 diamonds? No. I mean, if there is one thing that can just give you 30, 40 diamonds right away, what one thing can that be? Of course, if you do so much of clinical experience and so many publications, you will. Of course, if you get 2 publications of first author systematic reviews, okay, 40. But what is equal to 40? One thing. Maybe 50, probably more. Something else. Think about it. An extra high scores, of course. There is no comparison for high scores. I'm not denying it. High scores will be equal to 50 diamonds, maybe 60 diamonds, right? But what else can be equal to 50, 60 diamonds if you have low scores or you have an attempt? You do one thing and it adds 50 diamonds right away and ignores your failure. You know what is that? An extra master's or PhD degree. If you are not applying this year, you have a couple of years to apply. Go ahead and do master's degree. If you already took USMLEs, you have low scores, or you have an attempt, go get admission in master's in an American university, or go for PhD. Now, the number of diamonds will vary depending upon the rating of the university. If you do master's or PhD from Harvard, it will be 50, 60, 70, maybe 80 diamonds. But if you do PhD masters from your home country, will that worth? Absolutely it will. It will be like 30, 40 diamonds. It will still be huge diamonds. Because remember, the diamonds you are adding on your personality, nobody can compensate that. That also is valuable, extremely valuable. So don't listen to those people who will say that, oh, you have done your master's or you did residency in your home country, it will not be counted. Rubbish statements. They don't understand the concept of personal improvement. They don't understand the concept of self-improvement. They don't understand the concept of diamonds. If you did your master's in internal medicine, in any of the field, anything, any kind of master in your home country, it will be a lot of diamonds. It will be minimum 15, 20 diamonds still. If you did a degree from a very unknown university in your country, okay, 15 diamonds. But if you did masters from an American university, 50, 60 diamonds. If you did from Harvard, 80 diamonds. Suddenly you made a jump. If you do PhD from Harvard, 100 diamonds. Online diploma, why not? 15, probably 15, 20 diamonds. It will lesser than degree. But if you did online diploma from Harvard, if you did online diploma from Duke University, if you did online diploma from Mayo or Yale University, not Mayo, Yale University. If you did UCSF, UCLA, U San Diego, online diploma. Online, now this is American university. What about the universities in England? Wow. American education system respects universities from UK, and we have Very economical masters and PhD programs online from UK universities. University of Manchester, University of Cardiff University, University of Manchester, Edinburgh University, and then the two giants. What are the two giants in the UK? Two giant universities. If you get an opportunity, even a clinical rotation in those university hospitals, no, two giant universities in the UK, Cambridge and Oxford. Cambridge and Oxford. And clinical rotation where? King's London, King's College. King's College London, if you get rotation there, go ahead and do that. It will be way valuable than a rotation here in the US in a private clinic. What about Oxford? What about Cambridge? What about University of British Columbia? Yes, in Canada. We have wonderful universities. University of Alberta. Great universities, great university programs. And you can get rotation out there. And you can do PhD, masters. US system will respect the degrees from Canada, UK, and Germany. And do you know German universities are free? Do you know that? Don't tell me you did not know that. Don't tell me you don't know French universities are really, really economical. $500 a year. And you can do online degree. From Italian, French universities, from German universities. German, I think for European citizens, it's free. But you can check. You can go and check. And there'll still be, you will still get it very economical. German universities, yes, online and free. I think the only payment you have to pay is about the books, probably. I'm not sure now. The system keeps evolving. So you can search free online degree Germany. In psychology, if you're applying for psychiatry. In neuroscience, if you're applying for neurology. Go and search. You will find something. If not free, $500 a year. $2,000 to $3,000 for the whole degree. $5,000 maximum. Still very affordable. And UK, University of Manchester, Cardiff University, and Edinburgh University, online degrees, masters and PhD. You know these universities. Why I'm mentioning these universities? They are one of those universities that provide masters in your specialties, masters in internal medicine, masters in psychiatry, masters in neurology, masters in dermatology, masters in general surgery. Now imagine if you want certain specialty and you do masters online from a British university. These three, they are highly ranked universities: Cardiff, Manchester, and Edinburgh. Edinburgh is a giant university. Now, if you have master's degree from any of those universities in internal medicine, in nephrology, in neurology, see now, Google it. What specialties are available, what are not available. Clinical rotation in a German hospital will be valuable depending upon what is the rating of that hospital. Absolutely. And as I said, everything is a diamond except sitting idle at home, not doing anything. So do you understand now? If you are looking for internal medicine residency and you have low scores, now you have 2 years to plan. That you say, okay, 2 years will add some gap on my CV, but what if I take master's program in the UK from Manchester University in something related to internal medicine? Now, when you apply for residency, will it be valuable? Absolutely. Will residency directors appreciate it? Absolutely. Some programs may not, but many will. Most will. And some programs will, if you have a 5-year graduation cutoff, some program will not. Okay, of course. You are not looking at those programs. You don't care about them. You care about the remaining who are left, and you got to impress them and show your diamonds to them. So yes, English degrees will help. Of course, English degrees will be lesser of a help in comparison to an American degree, but will they be of some diamonds? Yes, 20 diamonds, 25 diamonds. Harvard is 80 diamonds, okay, 30 diamonds, but $20,000 is the whole master's degree course fee. And they allow you to pay in installments. One of my students graduated from Cardiff University in psychiatry, master's in psychiatry. Oxford and Cambridge, please Google it. They have online courses. They have online courses, I know. They will really help you. But do they have online degrees now? I think every university is coming to online because of COVID. But please do Google it. Online degree, Cambridge. Let's Google it. Okay, right now. Quickly. Online degree, Cambridge. Online master's degree, Cambridge. When I typed part-time master's degree, Cambridge. Online courses and part-time master's degrees. Are they online? They are part-time, but I don't see if they are online. Just Google it. Just search it. This is Cambridge website. So do you understand how many opportunities you have? Do you even imagine? If you keep adding diamond, it's 100% match. University of Miami is a good university. Again, as I said, if it's a university program, you have rotation out there. If they have residency program, very, very valuable, a lot of diamonds. But if it's not that, this will still be diamonds. Better than doing nothing. Better than doing nothing. Now, what else? Does anyone have Royal College credentials? MRC Psych, MRC GP, MRCP, MRCS? Is there anyone who has the credentials of Royal College? In the US, residency directors will look at it. You will be extremely valuable. Royal College credential can give you right away 25 to 30 diamonds, probably 50 diamonds. You don't know how the residency directors will look at it. If I were the director, I would have call you for interview right away if I see your MRC Psych, if I see MRCS, if I see MRC GP, I would call you right away for interview and I'll give you residency. I'll be sold. With your MRC GP, I'll be sold right away. By looking at your CV, because I trust the system. I trust MRC system, the Royal College system. Even before calling you for interview, I have decided that I'll give you residency because you have such clinical knowledge and experience. You are going to be an asset for our hospital. So what have you been doing? Why have you wasted time so much, guys? You could have added so many diamonds on your career, on your life, on yourself, on your CV. Everything would have changed so far. What else? And my pen is gone. My 50-cent pen. Okay. Actually, that's not a 50-cent pen now. You know why? Because Dr. Hassaan Tohid uses it. One day I'll be putting it in a museum. After I die, maybe people will put it in a museum. Dr. Hassaan Tohid used it. So it's $1 million. Okay, there's a question here. I've been applying for 4 years, 228, 230, pass, CS 217, general surgery, OBGYN, been doing prelims for the past 3 years, thinking that would be enough. Seems I have been going about in the wrong way. No, you're not going in the wrong way. You have added diamonds. You need to add more diamonds. That means these diamonds were not enough. Add more diamonds. Why didn't you go for a degree, extra degree? Why don't you go for a degree, a British university degree in your OBGYN? Master's degree. Add an extra degree. If nothing is working, where are your publications? How many first author publications? Why haven't you added 10 publications? Add 10 double-digit publications rather than wasting time. If you're not getting interviews, the problem is on your CV, that you don't have enough diamonds on your CV. Absolutely. Oh, that's MRC. Yes, MRC OBGYN. Yes, MRC OG in the UK. That's Royal College. You get this, you will be unbelievable. Now, if you don't want to do that, add some publications. That means if you're not getting interviews, that means you don't have enough diamonds on your CV. But if you are getting interviews and you're not passing interviews, that means you don't have enough CV. I mean, you don't have your diamonds here on your personality. Simple common sense. If you are getting interviews, you have diamonds on your CV. If you are getting interviews and you match, that means you had diamonds on your CV and you had diamonds on yourself. But if you get interviews, that means you have diamonds on your CV. But if you don't match, after taking interviews at 12 interviews and you don't match, 5 interviews you don't match, that means you did not have enough diamonds on yourself. Add your diamonds. Publications, more rotations, more courses, more certificate courses, more skills, language, Spanish. And if nothing, you can write a blog in an hour and we will publish your blog on the website for free of cost. Write blogs on internal medicine, write blogs on gynae ops, write blogs on neurology. I'll publish on my website. You will have enough evidence to show to the residency directors, I write blogs in medicine. They say, what is unique about you? I have publications, but I also write blogs in gynae ops. Wow. I write blogs in neurology. Wow, where are your blogs? These are my blogs. Oh, wow. Oh, you wrote 4 blogs. Wow, wonderful. 1-page blog. Write a blog on any single disease, on Parkinson's disease. Things Parkinson's patients should remember. 5 points. A blog by 𝓗𝓪𝓼𝓪𝓪𝓷. Ron Ahmed's blog on Addison's disease. Oh, that means she writes blogs in endocrinology. Oh, she's internal medicine person. And okay, tell me, anyone type, what specialty do you want? Anyone. I'm giving you another diamond idea. Type your specialty name. Type your specialty name fast. Hurry up. I want to give you an idea. Internal medicine? Okay, 𝓗𝓪𝓼𝓪𝓷 internal medicine YouTube channel. And every day you come and read a disease on YouTube. And you mentioned that on your personal statement and you mentioned that to the residency director. I have an internal medicine channel on YouTube. 𝓗𝓪𝓼𝓪𝓷 neurology channel. Hassaan pediatrics channel. I educate mothers and parents and fathers and about pediatric illnesses. Where's your YouTube channel? I can add extra value on your CV as well, on your personal statement, and on yourself as well. Because when you do your YouTube channel, you will study the disease first, right? Before making a video, you will study the disease, so you increase your knowledge. Emergency medicine, hygienist, Dr. Hygienist, emergency medicine channel, and you talk about hemodynamic shock. What do you do when you have a patient with hemodynamic shock? What do you do? Ringer's lactate. Dr. Khalid's channel on general surgery. Doesn't have to be expensive channel. You can use your computer camera. For so many years, my YouTube channel, I use my computer camera. Now I have a better camera, right? I have the good lens camera, but I started regularly. Will this impress residency directors? Why not? Is it adding diamonds? Why not? We don't know how many diamonds, maybe 5 diamonds, 2 diamonds, but better than nothing. An opportunity to show to the residency director that you are born for this specialty. Dr. Anushri, general surgery channel. They say, what is the proof that you are interested in psychiatry? People keep psychiatry as a backup when they don't match anywhere. What is the proof? He says, sir, I have been running psychiatry channel on YouTube. They would say, wow, this person is running psychiatry channel on YouTube. That means this is not a joke. This really is his specialty. Oh, Dr. Anushri Dr. Anushree, you have so many things. It looks like your CV is going to internal medicine direction. How do we trust that you really want surgery as your specialty? You say, sir, I run a channel on YouTube on general surgery. Why would I do that? That's the point. You're right. So guys, don't waste time. Make a channel today. How much time does it take? Write blogs on the same video. That, let me give you another idea. Let's say 𝓗𝓪𝓼𝓪𝓷 internal medicine channel. The first thing first she discusses is cardiomyopathy, alcoholic cardiomyopathy, or let's say dilated cardiomyopathy. Dilated cardiomyopathy. Dr. 𝓗𝓪𝓼 comes on her channel and she teaches people what is dilated cardiomyopathy. Dilated cardiomyopathy is this and this and this. A 5-minute video, and you finish it, and your first video is ready. Now, whatever you studied, you write it down as a blog, and you publish on our website. We will do that for you for free. So now you have two values, two added diamonds. You have a blog and you have a video. You have a blog, you have a video. You have a blog, you have a video. The problem is you don't want to do anything, and you want residency for free. Don't mind, I'm motivating you, okay? I'm being harsh because I'm motivating you. I want all of you to succeed. I want all of you to succeed. That's why I'm saying that you don't want to do it. I know you want to do it. I'm just saying it so that you motivate. I know you all want to do it. So why are you wasting time? You should start your channel today. 1 video a week and 1 blog a week. In 5 months, how many videos and how many blogs you will have published? And they will be visible on your CV? In your non-peer reviewed publications? Yes, non-peer reviewed publications. Your blogs that are published are your non-peer reviewed publications. You just don't know how to add value, how to add more diamonds. I'm telling you the greatest secrets, guys. If you follow it, all of you who are listening to me will match. If you really want to match, if you have some other goal, be a scientist or something, you will achieve that without any problem. So let's say hygienist has a topic on general surgery, emergency medicine. Let's say he has an emergency medicine channel. And now in the first channel, he talks about road traffic accident. A person with hemodynamic shock comes to you. What do the doctors, or what should a new graduate doctor, a resident who is alone without any senior, what should he do? Or what should everyone know? Even the senior doctors, you repeat the same thing again, and you write the whole story as a blog. You also publish it. So 4 videos a month and 4 blogs for 5 months. That means 20 videos and 20 blogs. If each is 1 diamond, how many diamonds have you added? The problem is you want to be successful, but you lack ideas. I'm giving you the idea today. Show your specialty, interest in your specialty. Khalid has a topic of general surgery. So Khalid, why don't you make a video on surgery, mesh surgery of inguinal hernia, umbilical hernia, or inguinal hernia, and you write the blog exactly on the same topic. You prove that you are a general surgery person. If you want to be a general surgeon, live surgery, eat surgery, sleep surgery, dream surgery, talk surgery, think surgery all the time. If you want to be a neurologist, talk neurology, sleep neurology, eat neurology, walk neurology, sit neurology. Every time you will be just thinking about neurology, and you will be getting more ideas about YouTube videos, about blogs. Why are you wasting time? Only 5 months left. Only 5 months left. Every day counts. If you write 1 blog today and make a video on the same blog, you will have 2 diamonds right away today. So that's it, guys. This is how you add value. Keep doing it, keep growing, keep improving yourself. And I think that's it for today. It's a very long session, and I can see everyone is still focused listening to me. Nobody wants to leave. I thought people will get tired when I'll be talking for more than 1 hour, but now we are approaching almost 2 hours and nobody has left. Look at the passion people have. This tells you all really want to grow. And nobody will teach you these things what I'm teaching you today. I can bet on that. Go anywhere on USMLE and train anyone who is helping IMGs or giving suggestions. How many people give these ideas? Now I'm throwing these ideas online live so that everyone knows these ideas and everyone teaches these ideas to others, and you teach your friends and your youngsters when you are successful that how you made the journey. Very good, Huma. Now go ahead and do that and just write blogs. If you are shy, let's say anyone who is shy doesn't want to come on camera for any reasons, for cultural reasons, for religious reasons, if you don't want to come on camera, you don't want to do YouTube channel, just do blogs. Just do blogs. Blog will be your publication. And the beauty of blog publication is you don't need to write a research question of that. You don't need to write answer a question. You can just write a blog on a simple topic. Idiopathic bowel, inflammatory bowel disease, IBD, simple. Ulcerative colitis, Crohn disease, Barrett esophagus. Simply on Barrett esophagus, you write down, you tell the signs, symptoms, diagnosis, treatment. Signs, symptom, diagnosis, treatment. Every blog will have this. It will be counted as a publication, add some value. And if you are not shy or you don't have religious restrictions to be on camera, go and do a YouTube channel. Yes, so all the new admissions, you make sure you create an account on the website and we will give you the access of the courses on your account. So I'll just text me and I'll tell you how. So that's it for today, guys. Thank you. I hope this information that I shared with you today, you will utilize it and you will grow and you will learn more, and it will make a huge difference in your career and in your life. And keep growing, keep adding diamonds. 5 months is a huge time. 1 diamond each day, let's say. How many days you have? 150 diamonds you can add if you add 1 diamond a day. Thank you, Hygienist. Thanks a lot. Thank you, everyone. Thank you. And just don't say thank you. Start doing it. Take action. Take action today. Make a plan of adding more diamonds on your CV and start doing it. Thank you. Best of luck. See you again very soon, next Tuesday. Thank you. Thank you, Hajra. Thank you, Anushri. Thank you, Sansan. Thank you, Mona, Hygienist, everyone. Huma, everyone. Bernicia, thank you. Gukul, thank you. Thanks a lot. Have a good day.